Hi everyone, this is Tori Vandeland with Prevent Connect. If you joined us on our recent web conference co-hosted by the Prevention Institute, you'll have noticed two things. One, the conversation our guests had and the stories they shared were amazing and so inspirational for advancing prevention. And two, we had some tech difficulties. We are so excited to re-release this web conference recording in 2 podcasts so our Prevent Connect audience can engage more with these conversations beyond our original web conference. On this podcast, Genoveva Islas shares how Mujeres Poderosas Amorosas Collaborative grew from a healthy eating and active living community health coalition to expand to prevent intimate partner violence against Latina women and immigrants.
Genoveva Islas, who is the founder and director of Cultiva la Salud. Beva is a child of Mexican immigrants and farm laborers. She is the first in her family to graduate from a university. Beva received her Bachelor of Science degree in Health Science and with an emphasis in community health from Fresno State and her Master in Public Health from Loma Linda University. Beva is a nationally recognized cultural health leader by the Robert Wood Johnson Foundation. Thank you so much for joining us today, Beva. Beva is part of the Safety Through Connection cohort, which is all about supporting prevention, starting with leaders beyond the domestic violence field. So Beva brings a lot of public health experience in other areas outside of violence prevention and was really recognizing the need in her community. So Beva, can you share a little bit more about the origins of the collaborative that you formed, which is called Mujeres Poderosas Amorosa?
I'd love to. So I just, first of all, want to thank Chen BOS for a wonderful presentation. I'm really proud to be on the line with them. So how Mujeres Poderosas Amorosas came about is essentially we had been working in coalition with multi-sector partners through racial and ethnic approaches to community health grant. And that was a 3-year grant. Most of the history of Cultiva la Salud's work has been about healthy eating and active living. So we've done a lot of engagement with disadvantaged community members who live in low-income neighborhoods around what are their interests to increase access to healthy foods? What are their ideas about promoting physical activity? And it really has landed us around policy systems and environmental changes. So as an example, within our REACH grant, we worked with community residents to advocate that the city and school district work in partnership to unlock school gates in order to provide children and families safe places to be physically active. Similarly, we've been very involved in the active transportation plan, really also involved in food systems work. And so that's sort of the history that we came in, sort of a very solid grounding in prevention and affecting policy systems and environmental changes in collaboration with community residents through community leadership development and empowerment.
Thanks for giving that background, Beva. As a newcomer to working on domestic violence prevention, what really made you want to work on this in the first place and really apply for the funding opportunities?
Yeah. Well, I think, I can share that, personally I have had issues myself in terms of unhealthy relationships that I've been involved in, and just really understanding at a personal level, what was impacting that, sort of what was informing my decision-making and my feelings and my ideas about being in those unhealthy relationships, and what a struggle it was to get out of them once I was in. So certainly at a personal level, I was very aware of issues around domestic violence. I think over the years, also, watching family members struggle with issues around domestic violence, I knew that it was something that was affecting my community and something that was really worthy of engaging and advocating for. Preventing. So I think it was exemplified for me in our work with REACH over the years, we've had instances, for example, where we've organized walking groups and we've had a large number of members participating walking, and then all of a sudden one of the members no longer shows up. And when we start inquiring about like, hey, what's going on? Why isn't she coming to the walking group anymore, or the Zumba classes, or, coming to the nutrition ed sessions? And we're told like, well, she's having problems with her husband. Her husband is very jealous. She's lost a lot of weight because of the walking and the nutrition education, and he doesn't want her to continue because he's afraid that somehow she's going to be sort of taken or going to get propositioned or something. So sort of these jealousies sort of also being insidious to women just promoting their own good health. We've also had instances, unfortunately, where some of those close community members, have shown up with physical signs of violence. So we knew that, definitely it was affecting our community. And as we began to explore the application, we really felt like what we had learned and gained in our expertise around prevention, because the focus of Safety Through Connections was on prevention, that it was something that we felt we could manage. And we invited those same REACH Coalition partners to join us in the application. We've continued to engage both direct service providers here locally, as well as non-traditional sort of sector folks who don't necessarily see a role or a direct role in domestic violence. And as we began the work, just really began exploring, what is it going to take to affect and build resilience among, in particular, Latina immigrants who we know for a variety of reasons do experience a very severe burden of violence. And I think that in the way that we sort of gained information and insight by directly speaking to our target audience, it just continued to reinforce how important it was to have somebody locally working on prevention and not just service, not just direct service. So I feel like it is definitely a good fit. And just moreover, because of my experience and, the family background and the things that I've seen growing up, for me, it's really rewarding. Like I didn't anticipate that aspect of it, of how rewarding and empowering for myself it was also going to feel in serving community members who I care deeply about.
Thanks for sharing your personal experience on the line, too. I know that can be hard to do on a web conference when you can't see everyone. But we're appreciative for you sharing your experiences and, what drew you to want to do this work. And even though you don't have, experience working in the domestic violence field until, starting this project, you really did bring a lot of capacity and previous experience in prevention from working on these other, public health issues. But I know that this past year has been a big year of onboarding as you've started to think about domestic violence prevention for the coalition's work. So what has onboarding to this issue really looked like?
Yeah. So I mentioned, I don't think that we entirely started with scratch. We sort of extended an invitation to organizations that we've had a long history of working with, and people that I know are also very sort of sensitive and passionate about the idea of serving vulnerable community members like immigrant Latinas. So it really began with a kitchen cabinet of folks. There's 5 or so organizations that formed the kitchen cabinet, and we sort of outlined sort of in response to what was being requested in our application, like how we would go about informing the process, like who would we want to talk to in order to gain insights about what we could do that would be beneficial and impactful to responding to domestic violence prevention among this population. And so we carried out 3 activities The first one was a survey. It's a survey, actually, thankful to you all, Alicia, that you provided, that really was exploring about risk factors in community that promote violence or allow violence, and then those risk factors that build resilience to violence. And so that survey we converted into a Survey Monkey, and we sent to the broad sort of stakeholders, organizational folks that we were in contact with here in Fresno County. Our interest was, again, to explore what we could do around domestic violence prevention for Latina immigrants living in Fresno County. So we knew that we wanted to engage urban sort of organizations working here in Fresno, as well as rural groups. And so we got some of those surveys. That was one of the first sort of points of information. We also elected to conduct some what we call pláticas, which are it's a Spanish word for discussions, but we wanted to host focus groups with Latina immigrants, and we really wanted those focus groups to be reflective of the diversity that is within the Latina immigrant population. So we had focus groups that were with younger Latinas. These were Latinas under the age of 30. We had some pláticas that were with Latinas over the age of 30. We had pláticas that were in urban settings, like here in Fresno, and in rural settings. We organized pláticas in an indigenous language. So we had 2 pláticas with Latina indigenous community members, and we did that with Centro Binacional here in Fresno. And so one was, they were both indigenous Latina immigrants, but one of them was in Mixteco, the Mixteco language, and the other was in Spanish. We also worked to try to conduct a focus group with LGBTQ identifying Latina immigrants. We didn't get as many participants in that focus group, so we actually decided to include them in some key informant interviews. And that was really the third prong of getting information back. So we wanted to focus on key informants that were within sectors that we knew had an important role to play in violence prevention. So, for example, we did some key informant interviews with contexts within the housing sector, key informant interviews with, as I mentioned, the LGBTQ identifying Latina immigrants, education experts, business development experts. We had some key informant interviews with local elected officials, law enforcement, immigration and naturalization advocates. So it was really a diverse grouping. And those 3 sort of sources of information we sort of sat with and digested and shared back with our group of broad stakeholders, so the kitchen cabinet, so to speak, the intimate sort of advising or organization that we had, and then the much broader stakeholders within Fresno County. And we shared back the findings, and we allowed for an opportunity also for those broader stakeholders to help inform what would be prioritized. We did group our interventions within 3 domains. Those domains were people, place, and equitable opportunity. And so that's sort of the method that we used in order to help us land on where we might work. Again, very grateful for the planning year and looking forward to continue to dig into implementation.
Awesome. Yeah, you really went through quite a assessment process and thinking about community members, different sectors, and, not just saying, oh, we're going to do this one survey and then that's it, but really thinking about how to engage community in different ways and really try and hear perspectives and be true to the process, not feel like you need to move right to strategy, but hear what the community is really saying is needed and what different sectors and, your broad stakeholders are thinking as well. But what has been challenging or required a steep learning curve as you've onboarded to this new issue area?
Yeah. So as a public health professional, I can tell you that prevention, the idea of prevention can be very abstract for a lot of people, and in particular, community residents. And I would say also in particular organizations that are very deeply rooted in direct service. So I guess it's very easy for people to make the connection like I'm hurt, I need a service, and I'm going to go to a counselor, or I'm going to go to somebody who can help me find shelter, or someone who can provide legal services, right? Like those direct services, when we say domestic violence, people naturally gravitate to that. But when we talk about building resilience in community, it's a little bit harder for people to say, like, okay, what does that look like? What could be interventions that actually help women not be vulnerable to the issues that cause violence? And so when you begin to explore that, I think people can get to like how important it is for women to have equal pay so that they can afford to live in decent homes, and even if they have to be the sole breadwinner, how they would manage that. But even talking about those good paying jobs, you have to think about like what's a precedent to that, and a precedent to that is women having good access to educational opportunities. And in order to participate in those educational opportunities, if you're here in California in the U.S., then you have to understand how English and English literacy really is an important foundation to that even as well. So I think when you begin to sort of backtrack about why Latina immigrants experience so much vulnerability, you begin to understand that women who have come from very impoverished regions of South America or elsewhere, where there has not been institutionalized educational opportunities that are free or low cost or widely acceptable, that they're coming here as immigrants working in very low-paying jobs where they are being exploited, that then requires them to have a dependence on somebody else to help sustain them. And when they begin to have children, how vital that dependence on somebody else for their well-being and their children's well-being becomes. And so I think, even though people cannot, perhaps the general public may not always be able to understand like what we're talking about in terms of building resilience, when you sort of break those things down to understand the factors that are causing the vulnerability, then it's easier for people to understand that, oh yes, economic development is prevention. Educational opportunities is prevention. So I feel like that's been a challenge, is just getting people to understand that those are some of the factors that we can work on together. And then what does access to those opportunities look like for vulnerable community members? So when we talk about equitable opportunities, we also have to understand the political and environmental sort of social context in where they live. And so just to explore that a bit, we live in a time where segments of our population are being directly attacked by people who should be protecting them, and I'm speaking specifically about people in government, in office, in the White House. We have a very entrenched anti-immigrant sentiment. We speak about building walls and banning religious segments of our community, and that creates fear. And when you have that fear, people who are vulnerable and are hurt and being abused do not want to continue to be abused and be vulnerable. So they do not feel comfortable reporting things that are happening to them, right? Or fear that if they go to a hospital for care, that they would somehow also be outed and potentially slated for deportation. So there are a lot of these sort of social policy and real sort of government policy that are also things that if we are successful at removing, that we could also create protective factors for women and people that are very vulnerable to abuse and violence.
Very well put. Now, as you're moving forward and thinking about implementation, Why is culture change important for your implementation, and what will that look like?
So culture change is really paramount, in particular with the Latino community. You know, what very similar to what Chan BOF was speaking to about the patriarchy within the Latino community. We have very entrenched ideas about machismo, and you know, I have to say also, just sort of in defense, that machismo does not have to be something negative. It doesn't have to be this sort of antagonism or minimizing of women, but unfortunately, it does become very oppressive and negative. So when we think about issues, again, that are very similar to the Hmong community, is young men are revered. We as Latinas do have to take ownership and responsibility about the fact that we are socializing our young men to adopt, this sort of toxic masculinity that ends up creating jeopardy to their future partners or to women sort of more broadly in society. So we do have to dismantle and change what we celebrate and lift up as machismo in our community. We also have to alter stereotypes about what it is to be an assertive woman. You know, being assertive is not being aggressive. And in our community, being what we call amable or friendly is something that is also very connected to the identity of Latina, that, you know, she should be serving to her family and she should be selfless about what is happening to her and just concerned about her children. And so, you know, those aren't at its base necessarily bad values, but we want women to love themselves and care for themselves, because ultimately when they care and love for themselves, they are better positioned to care and love their children. And so there are things about Latino culture, and as a Latina, I love my culture, but there are things that do become toxic and oppressive, and so we have to dismantle that in order to get to true prevention for our community.
Thank you, Veva. And I really like the pieces that you've talked about in some of our conversations before about how in working with mothers and grandmothers, thinking about the sons that they're raising and their daughters and all genders that they're raising, and thinking about, you know, how to set good social norms intergenerationally too. That's what's been really fascinating to me.